Both of my parents are physicians and grew up kind of looking up to them and the work that they do. They're both fantastic clinicians and so compassionate towards their patients. And I just wanted to emulate that. I chose rheumatology actually as a medical student. I really loved how rheumatology considered all of the different organ systems interplaying with each other, and loved that long-term relationship with patients in order to help them throughout their chronic care journey throughout their lives. The first visit, I really want to learn what their goals are. Everybody's coming in with a different agenda. So my first question that I always pose to patients is, tell me what brings you in, tell me your story and how I can help. And I feel like that really sets the agenda for us moving forward for the visit. Rheumatology often requires many more diagnostics in terms of labs and imaging tests that are fairly specialized that patients may not have had outside of a rheumatology visit. So my goal at the end of the initial visit with a patient is to be able to determine what our next steps of the diagnostics will be. And generally after that, we'll have a better idea of what our next step would be for their treatment. The long-term nature of rheumatology is one of the main reasons I became a rheumatologist. I love meeting a patient maybe when they're in their early 20s, they're just out of college and their first job, and then following them throughout their lives, through their marriage and pregnancies, their job and life transitions, and to be able to walk through them with this journey and, treat their rheumatologic disease so that it, has as minimal impact on the things that they want to do and need to do. It's incredibly fulfilling. My hope for my patients is for them to do the things they want to do, the things they need to do, live the life they want with their rheumatologic disease in the background. Of course, keeping up with treatments and doctor's appointments, labs, can be very challenging and burdensome, but I never want that to interfere with the life they want to live.